Today, we are going to talk about a small concept of adverse childhood experiences. If you're seeing a patient, child patient, or an adolescent patient, either in an emergency room or in an inpatient setting, many times your evaluation will not be complete without understanding of adverse childhood experiences. There is a scale for this also, but I'm going to give you some background concepts. It will be helpful in your clinical experience or in your clinical life, and also in the exam also they may ask you about this. So what you want to know is that most of the behaviors or symptoms the patients present are can be related to the childhood experiences. These are traumatic events that occur in childhood, usually between 0 to 17, and how it impacts when they grow up or during their childhood or adolescence itself. There are different kinds of experiences, like you can think about like physical abuse, emotional abuse, sexual abuse. You can think in form of neglect, which is physical neglect, emotional neglect, and basic needs not being met. And then there is also like if there is a family member with mental illness, or there is substance abuse, domestic violence, or parental separation, all this have an impact on the child. And these are characterized into adverse childhood experiences. What we want to understand is that how this impacts the child overall. So if you look at like the impact, there is physical health impact, there is mental health impact, and there is behavioral health impact. Long term, when you look at the journey of any patient who has gone through these experiences, they are at risk for heart disease, diabetes, chronic pain, and autoimmune diseases. This comes into physical health criteria. So if you want to recollect how it can impact, you can think on physical domain, mental health domain, and behavioral impact. So in a mental health, they're at more risk for being depressed, anxious, have PTSD, and emotional dysregulation, where they're developing aggression like ODD could be presented, DMDD can be presented, or they can also develop antisocial personality disorder. There is also a behavioral health impact where they are at risk for substance abuse, they're at risk for risk-taking behaviors such as antisocial personality disorder or so, social difficulties, and academic challenges. These are all the things which the adverse childhood experiences can have an impact on. But what happens at a biological level or a chemical level that these things are happening, that we can understand by understanding the biological mechanisms of adverse childhood experiences impact. So there are mechanisms. There's a stress response involved, there is inflammatory response involved, and there are genetic changes which are happening because of these experiences. So what happens in the stress is that you have more cortisol level, the HPA axis system is altered, there are more stress hormones related, nervous system becomes more hypersensitivity, like in PTSD, sympathetic system is hypersensitive, and you'll have all those responses, right? In the inflammatory response, you have more inflammation, more oxidative stress, there is cellular damage happening, and immunological changes happening, right? Now, this is causing the genetic changes. That is, at a gene level, you have DNA methylation, gene expression issues, and that is also causing like lasting impact on the patient. Now, you want to understand that the stress response can lead to inflammatory response, which can lead to epigenetic changes, which can in turn cause stress to be more. So there is a cyclical impact of all the experiences. So when you think about the abuse, physical abuse, emotional abuse, sexual abuse, you think about the neglect, you think about household dysfunction. This is having a direct impact on all these systems and how that is impacting at a molecular level and chemical changes in how they're present. Now, what happens with these changes is they're developing because of this physical health issues, mental health issues, and behavioral. Now, when you hear all this, you may think that, oh my God, when the kid experienced all this, the impact is lasting and there is no change. There is always hope if we intervene at the right time, we identify what the adverse experiences are, childhood experiences are, and provide trauma-informed therapy, counseling, medical support in terms of medication, and also community resources such as support groups, educational programs, family support services, and other personal development like how to cope with stress, how to be more resilient, and self-care practices. And medication also plays a role in addressing these things. But the goal should be whatever treatment you prescribe, you want to break this cycle. That should be your goal. And that can happen with utilizing all these treatment interventions and applying them. So, to summarize, you want to know what adverse childhood experiences are. You want to know what forms are there. You want to know what happens internally. And then what can you do? How is it manifested? And what can you do about it? These are the things you want to understand. I hope that this helps. Thank you very much.